Before, and I'll say it again. What's the cost of doing nothing? And I'm glad to hear that we're finally moving in a trajectory to do something.
Welcome back. That was Miami-Dade County Commissioner Mickey Steinberg talking about the Miami Center for Mental Health and Recovery. And as she noted, the center, promised to voters more than 20 years ago, appears closer than ever to finally getting the approval it needs from the County Commission. The county spent more than $50 million renovating an old building, but 2 years after those renovations were completed, it remains empty, helping no one. At any given moment, more than 1,000 people with mental illnesses are languishing in the county's jails. Not receiving the treatment they desperately need, this center could help many of them whose only real crime is being homeless and mentally ill. The culmination of Judge Steve Leifman's 30 years on the bench working with the mentally ill in the criminal justice system, the center would provide not only short-term care, but ongoing treatment and support. On Wednesday, county commissioners gathered to discuss the center for nearly 4 hours, and by the end, it was obvious the overwhelming majority of them were ready to move forward and open the center. The final hurdle? County Commission Chairman Anthony Rodriguez. It cannot move forward to the full board for a vote until he decides to place it on the agenda. Commissioner Raquel Regalado asked for it to be advanced to the next County Commission meeting, but Rodriguez refused to commit to anything.
I will take everything I heard under advisement and see how we move forward.
As we tape this early Friday afternoon, we are still waiting to hear what Rodriguez will do. He did not respond to a text seeking comment. One thing seemed clear, however. By the end of Wednesday's meeting, both Rodriguez and Commissioner Danielle Cohen-Higgins seemed frustrated, almost annoyed their attacks on the center failed to persuade their colleagues. For instance, when they both tried to suggest the center wasn't needed, the county's public defender, Carlos Martinez, stood up and let them know they were wrong.
In terms of filling the center, that is not going to be a problem. We have so many people. Right now I have 1,800 clients in the jail that have serious mental illness.
After that effort failed, Cohen-Higgins appeared to question Judge Leifman's motives for trying to help the mentally ill by asking if he stood to financially gain by the center opening and if he was going to be on the center's payroll.
What is your involvement going to be, Judge Leifman, once the facility opens?
I don't have any direct responsibility, but I am more than happy to raise money for it.
Time and time again, however, Rodriguez and Cohen-Higgins hammered on the eventual cost to the county of operating the center, suggesting the county would have to raise taxes or cut programs if the center was opened.
When the money runs out, whether the same people that are philosophically so much in support of this item are going to also champion and ask our taxpayers to raise their taxes to support it, because that is the ultimate decision that we will have to make. And if we're not going to be willing to raise taxes to support this, then what are we going to remove? What are we going to defund?
It's easy to, put your hand on your forehead and go and shake your head. Like, what are these commissioners not understanding? Like, don't they understand we need this? It's how will it be paid for? Like, how are we're going to open this for 2 to 3 years, and then how do we continue it? This is real. I mean, money, despite what people think, money doesn't grow on trees for government.
Of course, this was the same commissioner who 2 months ago made this statement when it came to spending nearly $2 million to update design plans for the Equestrian Center.
But a measly $1.85 million allocation to an architectural agreement that is necessary to comply with what the voters voted for gets a tweet from the fake news Herald.
Money for upgrading a rodeo arena? Measly. Money to help mentally ill people? Impossible. And let's be clear about something. The funding for the first 3 years of the center is covered, paid for using federal dollars and other outside sources. So what Rodriguez and Cohen-Higgins are complaining about is what happens 4 and 5 or even 10 years down the line. And that is where Rodriguez and Cohen-Higgins lost the argument, because the other commissioners acknowledged that with an annual budget of around $15 million a year, the center may eventually cost the county money. But they said it all comes down to a matter of priorities. Here was Commissioner Oliver Gilbert.
I take as true the chairman's supposition that this might not save us any money, And it may cost us, but what I do know is this. I've had a family member who went through the criminal justice system who was mentally ill, and I know that proper treatment shouldn't be in a jail. I know that. I know that we can't treat everybody in this building, but for those that we can, we should. I am prepared to tell the administration, work this formula, work with everybody, come up with the best plan, mitigate the cost as much as you can. The backstop for every service provided for this county is the general fund, period. I pay taxes because I want to actually help. I pay taxes for services that I don't use all the time. Federal taxes, local taxes. I pay taxes because the strong shall bear the infirmities of the weak. I start from the proposition of, is this something we should do? Will it help someone? I answered that question, yes. We got sidetracked on what I think is, I call it the sprinkles on a cupcake. We got sidetracked with this idea that it had to pay for nothing else we do. We don't ask police to pay for themselves. They can give y'all more tickets. We don't ask fire. You don't pay because you got an actual fire at your house or because you were experiencing a medical distress and you were having a heart attack and they showed up and they didn't charge you for the defibrillator.
Commissioner Vicki Lopez said she is confident this program will work.
And let me just tell you this, because, you know, I've talked about the 100 Lindas in my community, in my district, who are perpetually homeless and have intersected with not only the criminal justice system, but with the homeless trust. It strikes me that no one has talked about what police officers have to do on the ground. My police officers in downtown Miami will have a choice now. If we open this facility and we open it tomorrow, they will not have to make an arrest. They will be able to look at Linda and say, Linda, we love you. You need crisis stabilization today. And Linda will go into the facility. She will have crisis stabilization services, and she will soon move through a continuum of care that will treat Linda for exactly what we haven't been able to do for the 20 years that Linda has been on the street. Linda deserves to live in a safe and sustainable life, not on the streets or in the jail. Listen, we have a decreasing pot of money in the general revenue, and unfortunately, we will have to make the hard choices. And for me, it will always be people over buildings, and then those people vulnerable over not so vulnerable. This is for vulnerable people.
Commissioner Marlene Bastian spoke passionately about the need for the center as well.
Mentally ill people end up in jails, and sometimes they are hurt, sometimes they lose their lives. People self-medicate, they decompensate, they enter into crisis. Law enforcement becomes the first responder, and this is not acceptable. The jail becomes a treatment center. It is not acceptable. The taxpayer absorbs the cost repeatedly on the back end. This is not acceptable. Every studies tell us the same thing. Diversion and treatment costs less than incarceration and crisis response. Human beings with mental illness should not be incarcerated. They should not be in jail. They should be in a place where they can be treated with the dignity that they deserve.
Commissioner Keone McGee is a former prosecutor who appeared before Judge Leifman and praised the work he's done.
The fiscal question is not whether the county can afford this center, right? I think the question is whether the county can afford to keep it closed. I think the question of whether or not we can afford to keep it open will keep us here day in and day out. But if we get to the heart of the matter is, can the county afford to keep it closed?
And here was County Commissioner Rene Garcia, a longtime advocate for the mentally ill, going back to his days in the Florida legislature.
I've always said this. Every single one of us is one crisis away from having to need resources and help. Every single one of us. Doesn't matter who you are, how healthy you think you are. We can all fall into a situation where we need some help. I'm a fiscal conservative. I believe in social justice and social help for our people, especially when we talk about mental health services. However, I can't criticize any of our commissioners for asking the questions on the financial aspect of this. But I think we have to give it a shot. And you all know where I was at the beginning, and I'm at the point now where I think we do have to give it a shot and give the system an ability to see if we can take care of the most acute individuals and at the same time start developing a robust program that will not only help the most acute, because the reality is this is a family problem, but to help those individuals that are really struggling that never have access with the criminal justice system. And those are our neighbors.
Commissioners J.C. Bermudez and Keon Hardiman are on record saying they want the building open. Even Commissioners Roberto Gonzalez and Natalie Millan-Orbis appear to be on board. So the votes are there. And if the issue really is future funding, Commissioner Raquel Regalado, who has been working tirelessly to get the center open, argued once it does open, the county can work on getting that additional funding.
I also believe in this board and in this government and in our ability to find partnerships and to apply for grants and to look at the costs and to do the right thing. We do that all the time. We do that all the time. But you can't apply for a grant for a building that's not open. You just can't. I mean, it's a very difficult thing to do. You know, it's very difficult for Judge Leifman to go and ask people to give him money to do a thing that we're not doing right now. Because until you open the doors, it is just an idea. Until we are allowed to do the work, I just want us to open the doors. I just want us to open the doors.